Good morning, everybody, and welcome to our webinar. My name is Megan Landry, and I will be your moderator today. Thank you for joining us. We really appreciate you taking time out of your busy day to hear a little bit about our program here at the University of New England and some really interesting stories from two of our alumni. So in today's webinar, these are the things that I'm hoping that we can cover. We'll do some introductions and some backgrounds. And then two of our speakers will talk about the day in their life as they work in the field of health informatics. We will have time for discussion, and we'll talk about the health informatics program a little bit. And then at the end, we will open it up to question and answer session. And the best way for that is to please type your questions into the question box so that we can be prepared and ready for the questions when it's time. So today our panelists are Irene Chen and Michele Marshall, and myself as moderator, Megan Landry. I am the Program Director for the Health Informatics programs here at the University of New England. We started this program 3 years ago, and we have some fabulous alumni now, and we can't wait to hear about what they are doing. My background, I am a nurse, and I also have a degree in healthcare administration with a concentration in informatics, because back when I got my degree, that was the only option available to me. I've been involved in getting electronic medical records set up in 2 large systems here in the state of Maine as a manager and director, and have been involved in education for the past 10 years as well. Joining me today is Irene Chen. Irene, would you like to tell us a little bit about your background?
Good morning, thank you. My background is actually in economics. I received my undergrad degree from Suffolk University. I, of course, just recently got my master's from the University of New England in healthcare informatics. I really started my career actually at Boston Children's Hospital as a front desk outpatient float, going to different clinics, managing a lot of the front desk work. I then started working on our patient portal project, which really let me see a little bit of the technical pieces. Being on the patient portal project allowed me to move into the patient care services department, which really was a nursing inpatient focused area. And Boston Children's was very supportive of me receiving my graduate degree. I can then talk about some major projects that I've worked on. Speaking of the patient portal, I really helped with integrating our portal with other systems, as well as allowing patients and families to submit their own data into the portal as well as view. We also worked on an internal referrals project, which allowed for current PCPs to submit referrals to other specialty doctors using our EMR. I'm also a system manager for one of our, it's a patient, we like to call it edutainment, it's education and entertainment system in the inpatient rooms, and a member of our clinical informatics committee. On the next slide, you'll see just some screenshots of our big projects. I mentioned the patient portal. That's really one of my biggest projects that integrates with different systems. Nurse Call is our call-out system for the inpatient world. We really team up with engineering to test to make sure the different call-out systems work. It's a yearly test. We want to make sure that the right call-out to your nurse works, as well as any staff assist or code calls go to the appropriate teams. There's a little screenshot of this database tool that I use to build different power forms. And this is to help improve clinician workflow. And this kind of phone-looking screenshot is actually a project that I'm currently on, where we are replacing our current ASCOM phones with smart devices.
Great, that's all very interesting, and I can't wait to dig into that a little bit more with some questions. Our next panelist is Michele Marshall. Michele, would you like to tell us a little bit about yourself?
Sure. Good morning, everybody. I received my undergraduate degree in medical technology, or clinical laboratory science is how it's referred to more now. I worked for over 20 years in clinical laboratories within hospitals. I worked in the entire laboratory, so I've done pretty much all of the work, which is considered to be a generalist in the lab, but my passion and my first interest was always in microbiology. So as the years kind of went on, that was where I streamlined myself into microbiology. I did work for a short period of time in infection control, which also was a really nice play on the microbiology piece of it. I started about 3.5 years ago working for BD. Some of the major projects that I've worked on at BD, when I first started, I was an application specialist for BD. So I worked on implementation and training for their microbiology instrumentation and their database program. About 2 years ago now, a little over 2 years ago now, I started on the team for BD Synapsys, which is a health informatics platform for microbiology labs specifically. What we're trying to do is help improve the microbiology lab efficiencies. And currently we are continuing to add new instrument connections and some enterprise work, which will connect all of the different instruments in the microbiology laboratory as well as physical labs within an IDN. This is just showing a little snapshot of BD Synapsys. This is what we're really trying to achieve with Synapsys is showing a little bit of our whole process, the pre-analytical work that's done in the laboratory, the analytical work within microbiology, and then looking at the post-analytical results and data analytics.
Great. Thanks, Michele. That's really informative. And again, I can't wait to dig into this all a little bit more later. So at this point, we're going to move into the day in the life part of our webinar today. And we'll start with Irene. Irene, can you tell us a little bit about what a day in the life of your work is like?
Sure, I would love to. This was a Tuesday where it's my most kind of busy day with the patient portal. You can see a nice image of my desk with my wonderful Patriots team there. This is really where I do a lot of work related to the portal. For example, this day I had to do a provider alias upload. So that means any new providers that do come to the hospital need to be uploaded into the system that allows patients and families to send them messages. So that's a manual process that happens on a weekly basis. Along with doing portal work, I also support any questions, issues that nurses or doctors may have. They submit them through help tickets. I help support and train and triage questions that I can't help with to the appropriate teams. We also do a lot of integration testing. On this day, we were upgrading our Reg ADT system, and we just have to make sure that that upgrade went downstream to other systems appropriately. I tested the applications that I'm responsible for, as well as when we went live. Actually, 2 weeks ago, we integrated a new piece of our patient portal. And before going live, we just had to make sure that everything was a seamless experience. Tuesdays are my big patient portal team meeting where I work with developers, stakeholders, just to make sure any production issues. We go over any new enhancements. I also am responsible for the project agenda and the meeting minutes afterwards. And when I have the time, I also work on Powerform builds, which are what is used in our EMR to streamline clinician workflow. It's a busy day.
Yeah, I was just going to say, it sounds like Tuesdays are the busy day for you.
They are.
But it also sounds like you get to do a lot of different things, and I bet that's interesting.
Definitely. It makes the day go by so fast.
Yeah, that's awesome. Great, thank you. Next, we'll move on to Michele. Michele, how about you start and tell us a little bit about what your day looks like?
Okay, so for me, I'm an analyst. I'm actually one of the lead analysts with our software development team. What that means is that we're trying to come up with the requirements for the software that we're creating. We have a development team that actually codes the software, but we need to come up with the functionality, what we want this software to look like and to do. And so that's what I'm working with our analysts and our user experience teams. We also meet with other R&D teams within BD to integrate other instruments when we're working on adding a new instrument to the software. We work with our product owner who is in the marketing department for BD and leadership on what future items we might be integrating into the software. And then we have other key stakeholders within BD that we also need to get what their needs might be. So BD is a global company. This software is designed to work in microbiology labs around the world. So sometimes the requirements for other countries are different than the US. So we work with other key stakeholders in those countries to figure out their needs. So about a year ago, we released our first major release of our software. So a couple of the other big things that I've been doing in the last year is providing technical support and training to our internal BD teams, so marketing and sales, or technical support teams that work with the customers. But I've also done a little bit of work with actual customer visits and phone support for Synapsys at our controlled launch sites. So it's very busy.
Yeah, it sounds like it. And again, it sounds like you do a wide variety of things in a day, from technical things to support things, hearing from stakeholders. You really use a wide mix of skills.
Yes, definitely.
Great. Thank you. We'll move on now to our discussion part of the webinar. So first off, what has been, and we'll start with you, Irene, what has been the most rewarding problem that you've either improved or you've solved?
That is a great question, and I definitely have to say it is our patient portal integration. So a little background about that is we had a custom in-house designed patient portal, but it really was using different web services to pull the information, so it wasn't real time. When I first started on the patient portal project, we actually had an older vendor. We got rid of them and really did it custom based all in-house. We then wanted to streamline it some more, and this is where I kind of will go into our two different systems. We do use today Cerner as our EMR, while we use Epic as our Reg ADT system. We first integrated the Cerner patient portal, where patients and families could send messages directly that would land in PowerChart, as well as they're able to view lab results, clinic notes in real time, right when they're signed, right when they're resulted. We just recently went live with portions of the Epic MyChart portal that allows families to view their upcoming appointments, confirm, cancel, but also pre-check in. They could pay their copays online. They can actually update any insurance information, and we actually started self-scheduling. Demographics can be updated, so we get this a lot. I support some tickets from the portal as well, where people want to update their phone number, it's a wrong address. Now they can do it real time, immediately, and it reflects back into Epic. So I think this has been really rewarding, just to provide patients and families their own ability to view the information and also make changes when appropriate.
Yeah, it sounds like it's a really interesting project. I think it's nice to work on stuff that really makes an impact, and you can quickly see how being able to improve communication between the care team and the families is really fulfilling. So that's interesting. The other interesting thing that you mentioned is I had not heard of a system using two EMR systems, so Cerner and Epic. I had not heard of that integration before. So that is interesting to me, and encouraging that you can see these type of moves towards interoperability. So that's exciting. Michele, how about you? What have you found to be the most rewarding problem you have solved?
So one of the key things for a microbiology lab is blood cultures and making sure that an adequate specimen has been collected so that we can detect in the microbiology lab the organism that might be causing the patient to be sick. With BD Synapsys, in our first release, we did integrate our blood culture instruments. And so one of the really exciting things for me was being able to come up with a way where the microbiology lab can actually look at those blood culture metrics in more real time. In the past, we always were kind of looking after the fact. So you'd get to the beginning of a month and you'd look back at the previous month and see how you were doing. Now with Synapsys, we've created some analytics and ways for the microbiology lab to really watch this data real time, so that if there's a problem, they can make a correction sooner and it will then impact less patients.
So it sounds like this really improves the end goal for the patients, meaning that they get the results quicker, or if there's a problem, then the care team would know about that a little earlier.
Exactly. Volume of blood and having those blood cultures collected properly really can have a huge impact on the patients at the end of the day. So making sure that we've got the right specimen really will improve the chances of recovering the organism and treating the patient appropriately faster.
Great. Thanks for sharing that. Next question. Again, I'll start with Irene. What is something you've always wondered about your co-presenter's job or workplace environment?
Hearing Michele talk about her job, I really wonder what made her kind of shift from being a medical technologist to doing informatics. It's interesting to hear how you shifted being in 20 plus years in this field. So really, was there a certain moment or project where you just realized this is something that I want to do and I want to do informatics?
Yeah, so that's a great question. And I think for me, over the years working in the lab, I worked with the lab information systems at various facilities. I worked with multiple computer systems within the lab on our instrumentation. Then I started working with BD, where, again, I'm working with their instrumentation that has different built-in computer systems, but we also had this database that could work with multiple instruments. And a lot of times when you look at lab information system or these computer systems in the lab, they're just not designed really for the lab. They're done by a developer who doesn't always understand what's going on in the lab. So when the position with Synapsys opened up, where I could actually make a difference in this software to make it be as usable as possible, I just thought that that was an exciting opportunity.
That sounds amazing.
Thank you.
And how about we flip it around now, Michele? What have you always wondered about?
Yeah, so actually one of the things that Irene talked about, and I think you commented too, Megan, is the interaction between Cerner and Epic. Because I know for us, our software needs to integrate to these EMRs, and it's not always easy. And so I find it amazing to have those two working together. How did you find that was to get those two different EMR systems to work together?
We definitely hear that a lot. And I think maybe a clarifying point is the EMR, we really use Cerner's EMR. And then when we use Epic, it's more so on the Reg ADT side. So not really their full EMR. So it's almost like a portion of Epic. And then really we use Epic as the source of truth when it comes to demographic information and insurance and billing. Thankfully, we have great interfaces when that patient record is created. It does flow downstream into Cerner, and that's where the documentation and clinical information really goes. It definitely is a lot of testing, a lot of work with a lot of different teams, but I really think it is the best of both worlds having these two great vendors really working together. And I think we hear that a lot, how we're able to do it, but it seems so seamless.
Interesting. Well, thank you.
Great. Irene, so what would you say was the biggest challenge to your current position?
I definitely want to say it's changing people's workflow. A lot of the work I do is we work with vendors and improving certain systems. And if, for example, like our payroll system, we had to actually switch vendors. People were very used to kind of entering their time in something that was used for years. And then we switched over to a new system. With this, it definitely was a challenge getting people out of their comfort zone and almost forcing them to use this new system. But we really have to just emphasize the importance of one, this was a leadership decision to move to a new system, and two, to really tell them that these are improvements. We're trying to make your job easier, better. So it's dealing with culture change. Working in a hospital, I think, is one of the toughest things, and people are almost so set in their ways. But I think just really going down to a personal level and telling them that we're trying to make work easier for you and to improve not only kind of your work, but just work of the whole hospital. It's been hard. We definitely get some pushback, but there really is no other choice.
Yeah, yeah. Change management certainly is
Mhm.
a challenging skill, and people don't always like change. So it is hard. And how about you, Michelle? What have you found to be the biggest challenge in your current position?
So for me, the biggest challenge is one of keeping everybody happy. So, we're developing new software, and there's always things that people want different, right?
Mhm.
So, we create kind of the best that we can come up with, and then there's still people that it doesn't work optimally for. So trying to find those nice balances that allow it to be useful for everybody and keep everybody happy.
Yep, managing those stakeholders.
Yes,
Mhm.
All right, thanks.
you're welcome.
So thinking ahead to the future, Irene, maybe you can talk a little bit about what are you most hopeful or excited about when thinking about the future of health IT?
I love this question, and this is really kind of what drives my passion of even wanting to be in this field is really the future of technology. I've always loved technology, the use of computers and how things just it's so fast and quick. But with healthcare IT, I do find that it works a little slower than the rest of the technology, but we're getting there. So I think I'm really just hopeful to see the possibilities. I know I have Alexa all over my apartment. I wear a Fitbit. I would love to see how these technologies that are used day to day can be integrated to take care of health. I would love to, ask Alexa, how can I measure my heart rate or just
Mhm.
certain things like that, or even just my Fitbit if it could go back to my EMR. So things that just are so seamless. I'm really excited to see where technology goes with that.
And there's certainly, I mean, you can start to see some places across the country starting to do those things with consumer generated data. So I think that your vision isn't all that far off in the future, which is fun and exciting. How about you, Michelle?
So for me, I am most excited by machine learning and artificial intelligence.
Mhm.
I think that in healthcare, there are a lot of times where we see patients come in that just stymie people a little bit, and to be able to use artificial intelligence or machine learning to help guide what might be wrong with patients, I think that that's very exciting. And even within the microbiology lab itself, we have a lot of media that is chromogenic media. So it causes the organisms to grow different colors. And using machine learning and artificial intelligence type things to be able to look at a plate, see what colors, decide what that organism might be. Some of those things can just really streamline the workflow, even in the lab.
Well, that's interesting. I quite honestly didn't even know about that level of some of those details in the lab.
Yeah, it's pretty interesting.
Yeah, sounds like it. So Irene, what if you had a magic wand, uh, what is one healthcare policy you would advocate to improve technology in healthcare?
I have to throw this word around, and I'm sure people have heard this, and I think Megan, you also mentioned it a little earlier. It's just having truly interoperable systems. I think for different vendors to be able to communicate with each other and really have the patient first in mind. I always imagine if I was, I'm living on the East Coast, for whatever reason, my sister actually is out in San Francisco. If I was to visit her out in SF, and if something was to happen and I end up
Mhm.
in a hospital, I would like them, regardless of what system they're using, to be able to, in a quick and easy way, get the information that they need to treat me.
Mhm.
I really just envision and hope that true interoperable systems will be available.
Yeah, I mean that I would say that many of us have that same vision and passion because ultimately more information is what's going to improve patient safety and patient outcomes. So that's definitely something I think that lots of people have a lot of concerns about.
And just to add a little bit to that
Yeah.
too, is I feel like nobody wants to go to see the doctor. No one wants to end up in the emergency room. There's already so much going on, especially for the patient, but also the families and the caregivers. being in healthcare IT, I would love to make it easy. One less
Yeah.
thing for them to worry about.
Yeah, definitely, especially, your perspective of a children's hospital. You certainly want those kids and families in your mind forefront, to make that an easy transition during stressful times for them.
Mm-hmm.
And Michelle, what about you?
So I'm going to jump on the interoperability bandwagon as well,
Yes.
but
Yeah.
but maybe from a little bit of a different perspective, right? So in the laboratory, I think that one of the key things over time in the laboratory, we are definitely seeing less and less people getting into laboratory science, and yet the need is not going down. And so we're trying, and this is one of the things that we're trying for with our software, to kind of pull everything together so that there's less systems that you have to refer to get you from point A to point B and really help that patient. So we want to try and bring all of this information together into one health informatics platform. But it's really difficult when, again, the interoperability between different systems is very difficult. And, companies don't necessarily want to play nicely with each other.
Mm-hmm.
These are our competitors. And so they don't have a lot of reason in their minds, I guess, to play nicely together. But the ultimate reason is the patient and being able to improve things for the patient. So.
Yeah, that's an interesting, you have that vendor perspective, which is an important part of this conversation. We're always quick to say, well, the vendors need to learn to work together. I mean, that just kind of rolls off everybody's tongue, but there are reasons why they don't. It is business. There is economics involved in this, and so just trying to get everybody at a table to have some conversation, I think, is one of the ways to move past this. Is to try to open up the lines of communication between private and healthcare organizations and vendors, everybody involved, all the stakeholders.
Exactly.
Mm-hmm.
All right, we're going to move on to my favorite question. Irene, why don't you tell us a little bit about which one of your UNE Health Informatics courses was the most impactful for you?
Oh, that's a really great question. I feel like there were so many wonderful courses that I did take, and I learned so much. I want to say in my position, I really enjoyed the leadership in strategic planning in healthcare. My role is really to be seen as a leader, not at the leadership level yet, but I think this course helped me hone into skills I have that I could improve on, but also things that I was lacking. There were certain ways that I interacted with others that I could improve, and this class really helped me find the skills and just kind of do what I needed to do. Working in my position, I work with not only individual team members, but project teams. So it helped me kind of learn to read the room and read the different types of people that I interact with that work on this project. We all have to work together and really be able to motivate them the way that works best. So each, like situational leadership, each situation is different, and I really have to almost act in a different way depending on what the situation is. And then the strategic planning, I love that class because really being a part of the patient portal, just recently, it's a part of a bigger enterprise-wide goal is to improve more of a digital presence for Boston Children's. So this helps me really focus not only kind of on my little project from like a micro level, but just thinking of our work as a whole. I really want to say those classes were kind of my favorite, kind of focusing on the leadership perspective.
Yeah, those are two really good classes, two of my favorites as well. They are elective classes, the option to take them. The master's degree definitely focuses throughout the curriculum on making people think critically and about thinking about big picture and kind of the why of things and the leadership of things. But those two classes are really geared towards folks that are interested in moving into leadership for sure. All right, Michelle, now it's your turn. What was the most impactful course for you?
Okay, so for me, working on software development, I of course did like the database class. Our
Mhm.
database does utilize SQL, and so I got to get a little bit of a taste of that. But the bigger one, the better one, is one of the key things that I started off on my project was doing analytics and data visualization. So the data visualization class with UNE came just at the right time. And I think it really helped me a lot with trying to nail down what I needed to do with the graphics that I was creating. We've had this happen several times as we've brainstormed stuff as well. How are we going to portray this analytic, this graphic? And the class was hugely important for me to just understand what I need to achieve and how I need to show these data visualizations for customers. So I love that class.
Oh, that's great to hear. That makes me happy. So a data visualization class uses Tableau, and in that class, you actually get to use Tableau. So you leave that class with skills that you can put into work right off the bat. And there's nothing more impactful than a really good visual representation of what you're trying to say to the audience. So it can really help you convey your message in a very clear format.
Definitely.
All right. Next question. Maybe this will be the hardest. I don't know. What advice can you provide professionals beginning to consider a future in health informatics? Irene, we'll start with you.
I actually found this question to be, at least to me, fairly easy to answer. I think if you're considering it, I think you just need to do it. Now, really, now is the time to go into this field. I really think it's so exciting to be in health informatics at this time now. Just this whole kind of shift with the way we care for patients. I actually think of the different courses I've taken in this program. Instead of really going to a doctor and knowing that, okay, we just listen to everything the doctor says, we really have more engaged consumers now. And I like to, use the term consumers as really patients because they are consumers of health. I really think that this is the time to go into it. Right now is when decisions are being made, the technology is really starting to get out there, and you can be a part of kind of shaping really the future of healthcare delivery. So I absolutely advocate to stop considering it and just do it. I really enjoy my career, and I love every day is a new challenge, a new experience, a new learning.
Oh, I'm so glad that it's that impactful for you. That definitely makes my program director heart happy. How about you, Michele?
Yeah, and just to play off of what Irene said, and the just do it concept is that I think if you're looking at this career and this program and you're wondering, well, what would I even do with that? I think that was one of the questions that UNE did a great job of answering throughout the courses that we took. Is you really could see the different ways that health informatics could be useful in the future and what you could do with a health informatics degree. There's a lot of variety, and you think about one way that it brought interest to you, but then you start really working in the program and you find out all of the other health informatics pieces that you maybe didn't think of. So.
Yeah, I mean, that's definitely one of the questions that I get asked the most, like, well, what can I do with this degree? And I always have an audible chuckle because it's it's almost sky's the limit because there is so much you can do. And even if you have a list of things in your mind of the things you can do, like you said, Michele, that might change.
Right.
Definitely have people that came in with a certain interest in mind and they do their capstone project on something completely different because of either an instructor, a faculty member, or a class or content or a colleague, peer, something that's really, made them passionate that they've learned from in the program. So
exactly.
It's almost like what can't you do with this degree? There's just such a wonderful variety and range of different things that you can do.
Yeah, I agree. Great. Well, thank you so much for thinking about those questions and really giving some thoughtful answers to that. Before we get going with questions, and again, I hope you take a moment and type them in the box. We'll be on the webinar for some time to answer your questions. So feel free to ask anything, that would be fine. Just to tell you a little bit about what we do offer here at the University of New England. So we have both a graduate certificate and a Master's of Science in Health Informatics. Our master's degree is a 36 credit program. You can do it in 2 years. There are 3 focus areas that we have. So training and development focuses on training and developing teams that implement large systems in healthcare. Healthcare leadership, Irene talked about, those are the 2 classes that really help you set yourself apart as far as being a leader in healthcare. And then also our data analytics focus area is really more of a deeper dive into content around all of the data that is created with all of these electronic medical records. So our program is 100% online. And the graduate certificate is basically the first 6 classes, so 18 credit hours, but the first 6 classes of the master's degree. And what's nice about that is that if you start with the graduate certificate and you are done after that first year and you want to keep going, it's a very seamless process. It's a quick piece of paper and a signature, and you can move forward. So that's kind of one of the nice things about it. I will point out that in the past year, we have become a HIMSS approved education partner. So we were selected amongst several of our peers as providing some of the best education around health information technology. And it really does help you get ready if you're going to take a HIMSS certification exam. So now we'll open it up to questions. I know we have one question here. Michele, this one's coming to you. So the person asked, I am currently a medical laboratory scientist, and I'm curious what sort of experience you'd recommend getting to transition into a informatics position.
Well, geez, I really think that the program at UNE gave me a really good basis of the different ways that I could use the health informatics program. I mean, and for me, I got into the software development piece of it to try and, I mean, really as an analyst, they hired me for largely my knowledge in the clinical lab to develop this software. And then, everything I learned in the UNE master's program was just an added bonus for me, the SQL class, and being able to utilize that information right away as I was working with the software. I think just knowing systems, health informatics systems, having a strong a strong interest in working in that line will allow you to succeed no matter which path you choose.
Yeah, one of the several paths.
Mm-hmm.
Great. So let me just check in, see if we have any other questions. So the question is, can I get an entry-level job into informatics with the graduate certificate instead of the master's degree? Good question, and I definitely get asked this a lot. So graduate certificates can kind of serve 2 purposes. Oftentimes, people that already have one master's degree will take a graduate certificate because they just want the most basic of the information or knowledge in that area. So that's one reason. Another reason is that people want to kind of dive in, but they don't want to make the full commitment to a master's degree. So you certainly having a graduate certificate is certainly going to be more appealing on a resume than not. We always recommend that if you aren't sure how to go with that you would start with the graduate certificate, which is always going to look appealing to hiring managers for sure. And then if you want to continue on with the master's degree, you can do that as well. One more. So the question is from a pharmacist. So I'm a pharmacist with a high interest in health informatics. Do any of you think it would suffice to get either the certificate or go into the master's degree? There are pharmacy residency programs in informatics, but I do not want to go that route. So there is definitely a sub area of pharmacy informatics, and we have several pharmacists on our faculty. We have a couple pharmacists in our program. So there's definitely a natural liaison when you think particularly about the massive drug databases that you work with, that has to be spot on. The safety components around that is huge. So I think what you're asking again is that kind of that same question, graduate certificate, master's degree. I will say that I think, again, you can start with one, move to the other. The other thing that I kind of will put a bit of a plug in around this is that in the program, and Irene and Michele definitely experienced this, you're in classes with people from all different backgrounds. So you will learn a lot from your classmates. You may learn more from your classmates than your faculty because they come into the program with a different perspectives. And the reason I point this out is that sometimes people want to go into exclusively pharmacy informatics program or exclusively nursing informatics program. And while that is perfectly wonderful idea, what you don't get is you don't get that mix of backgrounds, which I think, Michele and Irene, maybe you can chime in a little bit. I think learning from your peers and the things they do and the experiences they have is amazing. I mean, I've certainly learned a lot. I know nothing about the lab world, and I've learned from Michele listening to her today, that's for sure. So.
Yeah, no, I would agree with that, Megan, that you definitely being able to capture those other experiences from your classmates, it's just going to give you an even more broad foundation in health informatics.
Mm-hmm. I definitely agree with that. And even doing my capstone project, I worked on the business analyst team, and that kind of just opened my eyes even more. And I think in my different classes and the different people that I've met and learned from, it does give you a different perspective, but you almost kind of use what you've learned and things you hear and apply it in a way that works for you.
Mm-hmm. Yeah, that makes sense. Thanks. On that note, I'd like to, is there more questions? Oh, okay. Hold on.
Mm-hmm.
I'm not entirely sure I understand the question. It says, if you have a RN, BSN, then the master's is the way, question mark. I mean, you could you could do it either way. You can start with the graduate certificate or you can jump right into the master's degree. Sometimes if you want to get the master's degree and you just want to dive right in, that's the best way to do it. And then you can also start planning for your practicum early that way. So I would definitely recommend that if you have a BSN for sure.
And can I just add a little bit to that too? I'm not a nurse by background, but my department is actually a lot of nurses, and they have that same kind of degree already, but a lot chose to move away from the bedside and actually go into our informatics department and also getting their master's. And they really work more on improving workflows. And especially being a nurse, you kind of know kind of the burdens that you deal with on a day-to-day basis. And I hear from them saying it's really rewarding to be able to make a change and really better the lives of other nurses.
Yeah, I mean, that's my story. That's for sure. I mean, I saw efficiencies as a nurse, but I worked in an emergency department, and the workflow there and the time that was wasted was just so frustrating to me when sick people were waiting for care. So working on improving workflows was definitely my passion project as I transitioned from a clinical nurse to an informaticist. So, okay, hearing no questions, I want to just thank you all for taking the time to listen to us today and to consider what's going on in the field of health informatics, some of the experiences of two of our alumni who have graduated from this program, and how both the faculty and the curriculum and their colleagues, how they've learned from the entire experience. So again, thank you for spending some time with us. And if you're interested in more information, you'll see on the screen several ways that you can reach out to us. I would say informatics@une.edu is a great way to email questions, so feel free to do that. Our phone number is there, 855-325-0896, and that will get you to one of our enrollment specialists who know all about this program, can answer anything you have, and if they can't answer it, then they can connect you with myself, who can definitely answer it. And then our online.une.edu website is also filled with a lot of information and a lot of stories there as well. You'll find we like to brag about our faculty and the students, so you'll find a lot of interesting information there as well. All right, folks, on that note, I think we'll wrap up. And again, thank you for taking some time with us. And you have some contact information. If you have any additional questions, we are here to answer them for you. And I just want to say thank you and goodbye to Michele and Irene for taking time to tell us all about their experience. So thanks again, ladies. We appreciate it.
Thank you for having me.
Yes, thank you.
You're welcome.